Yes, where Baystate Medical Center, speaking of vaccines, has officially administered more than 50,000 of them. Our Jordan McCool sat down exclusively with the president and CEO of Baystate Health to get an update on the hospital's coronavirus efforts.
I think that we're almost at the finish line.
The light is at the end of the tunnel in President and CEO of Baystate Health, Dr. Mark Keroack's eyes. This as the hospital recently celebrated 50,000 vaccines administered. Hospitalizations are also down after having more than 100 COVID patients for 12 weeks straight. The number has been in the 50s over the past several days.
That's coming down. It's still quite a bit, but nothing like what we went through between November and now.
Dr. Keroack tells Western Mass News the positivity rate is also going down across the Commonwealth, but it's been a little slower in Hampden County as a shift to those infected impacts the younger age groups.
Obviously, that's because we're doing a good job vaccinating older people, but also because in some of the younger age groups and some of the demographics, the following of the masking and social distancing is not as strong.
And as the numbers continue to trend downwards, Dr. Keroack wants to remind people to keep their guard up.
People ought to go ahead and get vaccinated, and they ought to continue to follow those public health guidelines. I think by the time early April rolls around, we're going to have a lot of vaccine around.
With more vaccines around, he says he's hopeful for a better summer.
I'm looking forward to a good summer. I really think it's going to be a pretty good summer where the case numbers are going to start coming down dramatically and things will be pretty much opened up.
All righty, everybody, let's stick with this where Dr. Keroack also says that he thinks by the summer, people will start to feel more comfortable as well, resuming social activities and being together, even predicting we could get rid of the masks sometime in the summer.